This segment is sponsored by Stec & Stein's Cosmetic and Family Dentistry.
Hi, everybody. This morning, guess where we are? Dr. Jacob Stein's. We're at the dentist office, a place where we love to come.
Yes.
Stec & Stein's Cosmetic and Family Dentistry. No, but you guys do great work here.
Thank you.
We have learned so much. And every time I come, you know, Doctor, I always have tons of questions.
Absolutely.
So
today,
today
we have some answers for you.
Yeah, and today we're talking about something that has changed dramatically in dentistry. I was telling you earlier, I remember going and getting x-rays.
Yep.
And you get that lead thing put on you that weighs, you know, like twice your body weight.
Yep.
And they got these big things, you know, taking x-rays. And then I don't know where the dental assistant went, but they went like in the next town.
The old school film exposure,
Exactly.
you know, sit there, wait 10 minutes, you know, and your heart's just racing to figure out like what news are they going to come in with.
Yeah.
So,
yes.
Yeah, that still exists, but
it still does.
Yeah, I mean, the newer technology is definitely making this process a little bit easier on folks.
How so?
So, you know, with the old school style film, I mean, it was a little bit uncomfortable and the results weren't necessarily instant. Today's world, we use, I mean, the term for it's digital radiography. So the idea behind that is when the x-ray is taken, the information is available immediately on the computer and we can see in a little bit more detail. You probably remember when your dentist used to come back when you were younger, you'd have like the little light box and the little x-rays, you know, and you'd almost need like a monocle to kind of read those.
Yes.
Nowadays, our information's available at whatever size monitor we have, and we have all sorts of different tools with our software that we can use to kind of help us pick through the information.
So no more we have to bite on that really stiff cardboard that's in our mouth.
Yeah, we've traded cardboard for like more of a new medical grade plastic. So we still have advancements to make, but we're walking down that road a little bit every day.
Now here we have, let's go to the computer screen, 3D images and this.
Yeah.
So tell us everything we're looking at and how this has all helped with the dentistry.
Yes, so your traditional dental x-ray is taken from the side and it's just one two-dimensional snapshot. I mean, most people are familiar with those x-rays that their hygienist takes, and for those we're looking at what does the bone level look like, is there cavities between the teeth, kind of some of the more common things.
But do you have to have x-rays every time you come to the dentist office?
It just depends on the person, you know. We tend to use the word prescription when we talk about x-rays with our hygienist. An x-ray is a prescription, and the intent behind that is we're looking at in each individual case and figuring out what's necessary. At the end of the day, we want to take as few as possible, but that's dependent on a person's dental history and also their risk. Some people are a little luckier, they don't develop problems, and some folks are on the other end of the spectrum where maybe they've had more dentistry in the past or they have a history of developed cavities and they may get different sets of x-rays or x-rays on more frequent intervals.
Plus, these x-rays give you such a closer look.
Yes.
And we're talking 3D, right?
Yeah, and so just for a little bit of orientation, usually our x-rays are taken from the side. So you bite down on the sensor and we see everything in from the side. A 3D image tells us a whole lot more things because we're essentially looking at this almost like a CT scan. We can look directly down the jaw, which is what you'd be seeing up here. We can also look at a bird's eye view. And then we can also look traditionally from the side. So when you're seeing things in 3 dimensions, we get to see a lot more of the anatomy of what's going on inside the tooth, outside the tooth, what's going on up here in the jaw joint. We don't do that for everybody, but for some circumstances that warrant that for a little bit more in-depth workup, the CT can be very, very beneficial for those folks and show us things that we're hiding actually on a standard x-ray.
So, like, let's take one of these, for example. What are you seeing more on this that you couldn't see on a regular x-ray?
Yeah, so really what I look for on a lot of these x-rays is inside the center of the tooth is a hollow chamber. In that hollow chamber is where all the nerves and blood vessels are located. So I typically will kind of look at that on a larger scale. If I'm looking directly down on a case, I can look through, almost like I'm looking through the chewing surface of the tooth, and I can see what's going on inside of here. What's hard to find is in between these roots, sometimes we get abscesses or infections that hide that we can't necessarily see from a standard x-ray. And looking at it in multiple dimensions helps really determine what tooth is causing the problem, where it's at, and what we might need to do to treat it.
So you can you make that even larger if you have to? Oh,
yeah, and we can scroll through it. I mean, essentially the way that I look through this x-ray is this is just one slice at a time. So as I move forward, I'm moving up and down the tooth. I'm on the chewing surface surface now, this is what a cavity looks like on the chewing surface.
That is so clear.
It's very clear. And this is a healthy tooth that's totally intact. So what I'm doing is I'm trying to tell where is that cavity in relation to this nerve chamber that's underneath. And as I scroll through there, I can tell where I'm at in relation. That helps us be more strategic when we're going through and removing cavities. How much do we need to remove to get the job done while maintaining the integrity of the tooth? And a lot of times this information helps us.
So when you get your information from this, how do you, what's the next step? I mean, you obviously know what you're going to fill in as a cavity or a root canal? Or...
Exactly. Yeah, a great example of it, what would be a next step is something like an implant. When Dr. CJ is doing his planning for an implant is essentially a little bit like a drywall anchor that goes in the bone and holds onto a tooth. We place those when people are missing a tooth. Dr. CJ will look at an x-ray like this and he'll figure out where he's going to put his implant within that bone to maximally hold on to it. So these x-rays are really beneficial for telling him where he's going. This circle you're seeing here is where the nerve is located. Where are all the vital structures that we need to avoid? And where's the spot that we need to place that anchor?
When you look at this and imagine what you did, years ago, I mean, this is really advanced for everything and for all your clients and your patients as well. So people are going to be looking at this saying, I am so comfortable that you know all this information. So tell us when they can come see you, how to find you guys, and where you're located.
Yep, they can see us Monday to Friday. We're here 8 to 1 on Fridays, and then 8 to 5 Monday through Thursday here at 2009 West Faidley Avenue in Grand Island. So come see us, and let's, and when we use these x-rays, I mean, we'll come up with a package that fits each individual patient's need.
Perfect. So I'm very relaxed now. Thank you for all the
Wonderful.
details.
Good.
My favorite doctors ever. So thank you, doctor.
Thank you.
Appreciate it very much. And we'll be right back. Stay with us.